Welcome to the Dr. Toomer Talk Show. I am Dr. Catherine Toomer, family medicine and community health physician, founder of Total Weight Care Institute. And I'm here today for the first Tuesday of the month, which I always do as a Q&A so that people can come in, ask their questions, and I answer them. So if you have questions, get them ready. If you think of some later, you can always write to me at help@drtoomer.com. And ask me there. I've received a few questions, emails, because people now know that if they can't make the show, they can always send me the questions in other ways. But if you post the questions here, I will see them. The other is let me know who you are and where you're watching from. Introduce yourself. It's always nice to know. And also just want to, if you really enjoy this and you like the information that you're giving, please go to my YouTube channel and subscribe. Share my videos with family and friends if you think that what I'm doing helps. And so here I am. Hello. Hello from Barbados. How are you today? And hello. She says, hello, Dr. Toomer, and everyone, greetings. Hello. Thank you for coming. So, like I said, if you have questions, you can post them here. I have some questions that I've received in emails and text. Well, messages, I should say, because I not through text messages, but messages on social media. But the other is if you comment on my YouTube videos, I do go back and I respond. However, I can't see those questions there now. So if you have questions, you can come in, post them here, and I will answer them. And so Jennifer says, howdy from chilly Nebraska. Oh my gosh, I know it's cold. I'm in South Carolina and it's cold, so I can only imagine how cold it is there. So, okay, so let's get started. First Tuesday of the month, always my Q&A. Thank you for being here. So I don't see any questions in the chat right now, so I am going to start with ones that I have that I received messages for. Marcy says, I'm good in Barbados. Has a chilly breeze this evening. Chilly in Barbados is not the same as chilly in the rest of for the rest of us. But I'm not mad at you. I loved my time in Barbados. It was a beautiful, beautiful island. Let's see here. So I have a question. I had done a video about, I'm assuming that's what this is about. I had done a video about information that you should know when seeing your doctor, or the type of tests you should ask your doctor for, or tests that you should know just to know if you're healthy or not. And so, so the question was, what, just to repeat what those tests are. Well, these are the things. I'm going to talk about tests, and I'm also going to talk about numbers. So the numbers you should always know, not whether they're good or whether they're bad, but the actual number. You should know your blood pressure. You should know your blood sugar. You should know your A1C, which talks about what your blood sugars are over a 3-month period. You should know your cholesterol. And if you're a man over 40, you should know your PSA. And if you're a woman and not so much your hormones, because, and I'll talk about hormones in a little bit, but when you're a woman, the things that you should know, or your colonoscopy you should have, everybody over 50, and then what your mammogram shows. So when it comes to your blood pressure, 135 over 85 is what we consider normal. Anything above that we say is high. So anything above that you should, and it has to be 3 separate readings for it to be elevated before you say you have hypertension. So you should know that number. You should know what your fasting blood sugar is, mainly because if it's high, that means something. But you also should know your A1C. What your A1C is, it says what your blood sugars have been running for about 3 months. When it comes to your cholesterol, you have your good cholesterol and your bad cholesterol. But there's also another cholesterol that you should know, and that's the lipoprotein A. That number tells you what your cardiac risk is from your cholesterol. Now, you can have a normal cholesterol and have a high lipoprotein A, and that puts you at risk for cardiac disease, so cardiovascular disease. So it's good to know that number. If you're having certain symptoms, you should always want to know numbers that might feed into that system. Like If you're fatigued, you want to know what your thyroid function is doing. If you get checked for vitamin D, that talks about your exposure to sunlight and also your nutrition. Your CBC, your complete blood count, will also indicate if you have some nutritional issues like iron deficiency. And so getting what is considered a primary care panel, which is your cholesterol, your lipid panel, your cholesterol, your CBC, your complete blood count, your CMP, which complete metabolic panel, which includes your renal function and your liver function. And so if you have those things, and then your A1C, those will actually give you a good idea of what your health parameters are. And so, but you know the numbers, write them down if you have to and keep them with you. And the reason that's important, because just knowing if something's good or not is relative, and it's not really that's not a good indication of how well you're doing. I can't tell you how many times I've seen someone told that their A1C was good, and what they meant was it wasn't diabetic range, but they were pre-diabetic. And when you're pre-diabetic, they lots of things can happen in that area, in that range. So hello everyone who's come in. Please let me know who you are and where you're listening from. Always like to know. We had a pretty international viewing a couple weeks ago from all over the world, and it's always fun to see. All right. So any questions, put them in the chat if you can. So let's see. I'm also going to check Facebook because I'm not sure if the Facebook chat is coming up. Hold on, make sure my sound is down so it doesn't. Let me see. Hold on. Sorry. I always, was hoping that. Okay, it's not coming through there. All right. So hello, Tanya. Nice to see you. So, well, like I said, I have other questions. So I will pull those up and we can talk about those. Hold on just a moment. Okay. So I have a question about GLP-1. And so what should I am using a GLP-1, and I had a relative tell me that I was cheating for using a GLP-1 for weight loss. What should I tell that relative? Actually, I get this question a lot. So GLP-1s, the reason they work is because you have to have a metabolic issue going on. What happens in our body to make fat is that it takes calories, and then our body takes calories. Our brain says, okay, either take those calories and use it as fuel, send it to the muscle as fuel, or take those calories and turn them to fat and store it as fat cells. There's lots of different reasons why that happens, but the number one reason that happens is genetics causing insulin resistance or prediabetes or diabetes. They're all on the same continuum. So what happens when the brain keeps telling the body to take little calories and turn it into fat, it's getting a mixed and wrong signal itself and then sending a wrong signal to the rest of the body. So what GLP-1s do is they help the brain get the correct signal so that the brain then sends out the correct signal and says, don't take those calories and make fat, instead make fuel. So that's why for some people, even when they can lose weight without a GLP-1, they can't keep it off because that mechanism, the neurometabolic mechanism of the brain, overrides everything. And so it's not cheating when you use GLP-1s because it is correcting a chronic metabolic issue. So when people say you're cheating and you're going the easy route, I always ask, why is easy such a bad thing? We do a lot of things in the easier way. We do a lot of things in a way that we say is efficient. So when someone says you're going the easy way as if that's a bad thing, ask them how they wash their clothes. because it used to be where people had to wash their clothes in rivers. But now we have an easier way of washing clothes, and that's in a washing machine. And so if easy is bad, stop washing your clothes in a washing machine and wash them in a river instead. Don't drive a car. Walk to wherever you need to go. I mean, there are lots of things we do that are easy and we don't have a problem with it, right? So why should this be any different? The reason that people have a problem with this isn't because it's easy. Because if you don't mind washing clothes in a washing machine being easy, but you do mind somebody who's losing weight using a GLP-1 to get their metabolic status under control, and that easy is bad, it has nothing to do with the easy. It has to do with where it's being applied. And that means that person is biased, again, is just weight biased. So Sherry Dexter says, no river washing for me. I'm with you on that one. I might use a bucket, but that's only for a few items, or in a sink, and that's if they're delicate, but I'm not using it for all my clothes. No, that's not going to work. Okay. So if you have any questions, you can post them in the chat. Sherry says any type of help is needed is a blessing. I agree totally. So again, if you have any questions, post them in the chat. I'm going to go to the next question I got, which was when should I get a mammogram? Well, it really depends on your insurance, unfortunately, because now, insurance is saying that if you have, they're saying start your mammograms later, and if you have 3 consecutive normal mammograms, you can spread them out. Well, what we used to say is start getting your mammograms at 40. Unless you feel something in your breast and you get a mammogram at that time. And the way when you should start checking your breast really is about as early as possible. So definitely around 21, and once a month at the same time, every month, you do self-breast exams. And the way you do self-breast exams is you should always start from here, your collarbone. And the reason is that you have lymph nodes right here that if you have some type of cancer, they will react. And so you want to start here. And also you want to make sure you get up under your arm here, because there are other group of lymph nodes that cover this area. And so essentially what you do is you start here in the middle of your breast and you just do little circles, and you move down, do little circles, do down, move little circles, down those. And you do that kind of like a lawnmower motion. So you kind of go up, down, and then up, and then down, and then I'm not going all the way down because you can't see my hand, but essentially you go down, then up, then down, then up, and you move over and just do this the whole way over. Now I'm only going to the end of the photo because you can't really, picture a frame because you can't see beyond, but essentially you go all the way down to cover your whole breast, go over a little bit, and then come all the way up, and you do little circles, move down little circles. And what that does, if there is something that is hard or fixed, you want to report that to your doctor. Or the other is you take a look at your breast and look at the skin over your breast. If the skin over your breast is thick and looks kind of like orange peel, like almost like a large mosquito bite, you definitely want to talk to your doctor. The other is if you have any type of discharge that's an unusual color or is painful or has blood in it, you want to talk to your doctor and get a mammogram right away. And also, if you put your hands on your hips, I'm going to do it like this, but on your hips, and then you push in with your hands. If there's an underlying mass on your breast, sometimes what will happen is the skin over it might buckle down like that. So when you're activating the muscle, and so what should happen is that muscle should push up, and everything underneath it should push up. But if it pushes up and then part of it dipples in, that means there's something in there stopping your breast from pushing up. And often it can mean that there's something in there. And so you could get that checked. Now there are really good videos on YouTube and online. There's other, you can find, search how to do a good breast exam, a self breast exam, and you should do that once a month, every month, at the same time every month. And part of the reason why it's important to do it at the same time is because our breasts change when our hormones change. And depending on how old you are, your hormones fluctuate throughout the month. And so, and as your hormones fluctuate, your breast tissue changes. And so you want to make sure that, you know, you're feeling your breast at the same time, so that you're not feeling something different because you're feeling at a different time of the month. So, but I know that was a long answer, but monthly breast exams from the time you're 21, you should do mammograms from 40 on. If you have a family history of young cancers, you talk to your doctor about when that happened, and they may move that forward. Or if you feel something in your breast, they may do an ultrasound first, and then do a mammogram, but definitely report it to your doctor right away. I hope that answers the question the person asked. Jennifer says, I know the underarm, but didn't know to start so high. Thanks. Yeah, you actually have lymph nodes above your collar. Like, this is my collarbone. You actually have lymph nodes right above it too. But you don't have to do all that, but definitely start up high. You can have breast tissue all the way up to here, and then your breast tissue goes all the way up under your arm. So, Jennifer says, I just had a mammogram. I got a report that my breasts are smart. They said that they're not dense. That was pretty good. I have to remember that one. Yeah. So yeah, she has smart breasts. Actually, that was pretty funny. So yeah, when you have dense breasts, that does make mammograms a little tricky. That's why breast exams are so important, because you should know your breast better than anybody. So that is for breast exams. So let me see. Another question here. Oh, I had them pulled up, and then I next time what I'll do is I'll write them out and put them in one place instead of looking for them when it's time for me to do this. Okay. What is it to study stress? Oh, okay. Someone asked me a question saying, I talk about stress reduction a lot. What's the best way to reduce stress? Usually, there's three ways of reducing stress. Well, this is what I always talk about. When it comes to stress, you have to think about what the immediate thing you can do, the intermediate thing you can do, and then long-term thing that you can do. The most immediate thing you can do is try to get your cortisol down as quickly as possible. The other most immediate thing you can do is remove yourself from whatever it is that is making you stressed. So when it comes to getting your cortisol down immediately, box breathing is the easiest. Trying to relax through breathing is actually quite effective. You can go on YouTube and look up box breathing, and it'll show you how to do it. But essentially what it is, you breathe in, you hold, you breathe out, you hold. Breathe in, hold, breathe out, hold. Now there's different numbers that you can do, but the easiest in the beginning, you do 4 in, hold for 4 counts, down, out for 4, and then hold for 4. And you breathe in through your nose, hold for 4, breathe out through your mouth, hold for 4. That is called box breathing. And if you do that in a calm place where it's quiet, it can actually bring your cortisol down. Now, it's also very important that when you breathe in, that your diaphragm, that your stomach pokes out. Many of us have a bad habit of breathing and sucking our stomach in. It should actually push out when we're breathing. So if you put your fingers on your stomach when you're breathing out, it should do this. So, when you breathe in. So when you breathe in, your fingers should pull apart. And then when you breathe out, they come back together. That's how you know if you're breathing in properly. And so if you do that, what that does is it tells your brain to calm you down. So that's the most immediate way. Intermediate is to learn how to not let things stress you. And the way you do that is there's a couple of ways of doing that. One is through therapy. The other is sometimes medication is required. And then other times it is understanding why you react to the things that you react to. And so, again, therapy helps with that. Or writing down patterns and seeing patterns and then avoiding the things that trigger you when you notice that there's a pattern. Then the long term is to get rid of the stressor altogether. Now, if they're your children, you can't really do that. But you can learn how not to react to your children. That's the intermediate. But the long term is, if it's a job that's stressing you, then you start making plans on changing that job. If it's a relationship that's stressing you, you start making plans of either changing that relationship or getting rid of that relationship. If it's financial, you start working on ways of improving your financial situation by getting financial counseling or learning how to budget, or, so I think you understand what I'm saying. So it's like immediate, get your cortisol down, breathing. Yoga is another thing, Pilates, meditation. These are all things you can learn. Intermediate, therapy, sometimes it may take medication, and then dealing with the actual removing yourself from the line of fire, so to speak, of whatever it is that makes you stressed. And then the long term is changing your situation and just absolutely removing, changing the stressor. If it's just, especially if it's something or job, family, friendship related. So hope that answers the question. Any questions from those listening? Type them in the chat if you have any. I try to keep this as short as possible. We're at the 22-minute mark, so I'm trying to keep it under 30 because I know it can get long. So if you have questions, now is your time to ask them. All right, let me see one more. Okay. I have another GLP-1 question. And the reason I know that I talk about GLP-1s a lot, part of the reason why I do is because people know that I've been prescribing them for a very, very long time. I started prescribing GLP-1s about 15 years ago for weight management, metabolic management that resulted in weight loss about 15 years ago. And so I started with Victoza. Actually, when I first started using GLP-1s, we still had Byetta. So yeah, that's really a long time ago. And but using Victoza and then an Ozempic, Wegovy, and then Mounjaro and Zepbound. But so I often get a lot of questions about GLP-1s because I do know a lot about them. And so the question I got was, what's the lowest GLP-1 dose you should be on? Should you be on a GLP-1? Should you change your dose on a GLP-1 based on how well you're doing or based on the recommended schedule? That's actually a very good question. So the lowest dose, so the GLP-1 dose, everybody has what I could call their golden dose. And what that golden dose means is that you're actually getting metabolic correction. And we measure that metabolic correction right now as weight loss. However, there are other metabolic correcting side effects, which weight loss is one, but then sometimes it's inflammation. So you could have lower pain, better sleep, less, especially joint pain. So inflammation starts coming down. Energy starts to go up. So these are all things that happen with GLP-1s. And when we have your appetite drops, and mainly because your brain is getting the right message and sending out the right signals around appetite. And so these are not starvation medications. They don't drop your appetite in and of themselves, but they do it because they work on the brain, and it's the brain that drives your appetite. So the dose that this happens is different for everyone. So the way I determine what is the best GLP-1 dose, I first, do you still have an appetite? You want to be able to eat. You have to maintain your caloric intake or your metabolism suffers. So do you still have an appetite? Yes. Are you overeating on that appetite? No. Perfect. That's the dose. The other is, if you do you are your is your energy level going up? Yes. Okay. Then that's fine. If it's starting to go down, we have to address it, because it might be because you're under eating. It could be that you're on too high of a dose. Um, the other I look for is, are you having side effects that are adverse side effects? Nausea, vomiting, diarrhea, severe constipation. Are these side effects affecting your daily activities? Are they keeping you from being able to concentrate at work? Are they keeping you from wanting to go to school? Are they, interfering with you interacting with people? Is it interfering with your social life? If the answer is yes, then you need to drop the dose. You got to adjust it, because you don't want to have anything that disrupts your life in any sort of way. And then the other is, are you and then the are you having any reaction in other ways, any skin reaction, and just basically any type of reaction to the medication. But primarily what I look at are side effects, and including weight loss. So I want it to be between half a pound to at most 2 pounds a week on average. And the reason is if you go faster, you're at risk for gallstones. So weight loss at about half a pound to 2 pounds a week on average. Limited side effects, so that it's not affecting your activities of daily living in any way, or your psychosocial relationships of any type. And then the other is that your appetite is maintained. You still want to eat, because it's really, really important that. And then if you have side effects, there's always ways of getting around them. We can always do things to help with them, but they have to be reported. So if you're on a GLP-1 and you start having side effects, talk to your doctor right away, so that way you can do something about it. If you're taking a GLP-1 and you're not working with the doctor, fine when you are. You should not be using these medications without guidance and without monitoring, because that's where the dangers lie. Okay. Hi, Denise from Pennsylvania. Came in. I just wanted to say hi. And so, like I said, for every single person, there's a golden dose. Their dose is different. Now, the way I change doses is not because it has to be done. I wait until there's a reason. And usually what happens is, if someone comes to what they call a stall, they stop losing weight, or they stop having the benefits that they had before. Someone with food noise, the food noise will go away. If it starts to creep back in and it's not from change in stress or drop in muscle, then you may go up in the dose. And so it's really important to go based on the individual, not just because it's every 4 weeks. Because what that happens, if you go up every 4 weeks, just because, you run the risk of overshooting, and then the person drops too much weight and they end up underweight. So, so that's how it should be done. That, unfortunately, that's not how it's always done. But, so if you have questions about that, if you're on a GLP-1 and you're not really sure, keep an eye out. So I'm going to make an announcement right now before I sign off, in that I have a group where I coach individuals, or coach everybody, but you can come in, drop in, ask your questions, and particularly around health, wellness, weight management. So it could be about menopause. It can be about hormones. It could be about medication. It could be about, how do I, get along better with my doctors? I mean, it doesn't matter. And if it's something we can't answer, then we will definitely refer you or tell you where to look. And so it's really important that I'm just give a place and give a space where people can ask their questions without judgment, from people who are experts in our fields. And I have another doctor who will be helping me with this, so that we can do more than 1 day a week. And that will be Dr. Beckford. So we'll have all this information for you. So if you're interested, you can write to me at help@drtoomer.com, just so that I'll have your email address. I will be sending out information and announcements by email. So if you want to be on that list, then write to me at help@drtoomer.com, so that you can be on the announcement list, and you will know exactly when that happens. Okay. So Denise has a question. She said, I've been in maintenance for 6 months on 5 milligrams of Zepbound after losing 83 pounds. Well done. I'm starting to pick up weight again after trying to increase my caloric intake. Should I go up in dose? Yes. Simple answer, yes. Because if you need the calories, you need the calories. If your body cannot handle the calories because of your metabolic status, then help your body with a higher dose. So go up to 7.5. Now, if you, especially if you're picking up your calories. Now, if you go up to 7.5 and suddenly your appetite completely stops, then there has to be other things addressed. You have to have, again, it's so individualized. There's other things you need to look at and address, but the easiest answer is yes, go up to 7.5. Go up in dose. Because 5 milligrams, I can tell you, is a very small dose as far as the medication is concerned. All right. Okay. Well, we're at the 30-minute mark, and I know your time is precious, and I want to respect it. So again, write to me, help@drtoomer.com if you have questions. You can also write to me at help@drtoomer.com if you want to be on the announcement email that will tell you how you can be a part of the group and how you can be a part of the coaching group and drop-in group that we'll be having 2 times a week, so that you can get all your questions answered and you can have a place where you can have accountability, you get support. If you want to create accountability partners, whatever it is that you need around your health. Now, this is not a treatment group. This is a coaching group. So if you need treatment, there'll be other options for you. But this is going to be a place where you get what you need in order to get healthy, be healthy, and stay healthy. All right. Well, thank you. I will see you next Tuesday in the Dr. Toomer Talk Show at 6 o'clock live. And again, if you have any questions and you want to talk to me in other ways, you can write to me, help@drtoomer.com. Good night.